All right, welcome back to another module of the Crohn's and Colitis Solution. My name is Dr. Sean Golden, and in this episode, we're going to be talking about number 4 of the big 4 for the Crohn's and colitis supplements. Now, these first 4 supplements I call the big 4 because they can just have such a profound impact on the course of the disease. After these first 4 supplements, we've already talked about niacin, vitamin D, melatonin, and now we're going to talk about white willow bark. After that, we're going to be going into a few more ancillary supplements that may not be as dramatic of improvement, but it can still help quite a lot of you guys out there. And so I want to still put that in here for completion. After we get through those ancillary supplements, then we're going to get into the diet strategies of the course. And I know a lot of you are looking forward to the diet strategies part of the course, and for good reason. Diet is very important, but just keep in mind that it's my goal for you to have as much freedom from your condition as possible. I don't want you to be very limited in the types of foods that you choose. I don't want elimination diets to rule your life. That's a band-aid approach, in my opinion. That's sidestepping the issue instead of actually fixing the gut. So the first 4 supplements all act on the immune system. They all help regulate it in a very beneficial way, and they can really help with these conditions. So I really hope you're starting to think about and implement some of these suggestions. In today's module, we're going to be talking about white willow bark, which is another one that can really help, possibly really help you. Now, white willow bark is considered nature's aspirin because back in the late 1800s, Bayer, the company, actually created aspirin from white willow bark. You see, white willow bark's been used for thousands of years for a lot of different inflammatory conditions, including just general aches, pains, headache, arthritis, things like that. Now, in the late 1800s, Bayer was like, well, white willow bark's natural, you can't patent it. How can we create something that works like white willow bark does, but we can change it a little bit so that we can patent it and make a lot of money off of it? And that's where they created aspirin. Now, I'm going to be showing you some molecular pictures, molecular diagrams with some sciencey sounding names. Just stick with me for a few minutes. It might sound technical at first, but you're going to get the hang of it. I'm doing this for a reason. I want you to understand what the molecules really are so that you have a good idea of how white willow bark can help you. So this is how white willow bark works. You take white willow bark, and one of the active compounds in white willow bark is called salicin. You can see that on the left-hand side here. So salicin it goes into your mouth, goes in your stomach, but bypasses the stomach, bypasses the small intestine, and goes into the colon. And in the colon, the bacteria convert salicin into salicylic acid. Now, salicin is inactive. Salicylic acid in the middle is active. That's the active molecule. Now, aspirin is on the right-hand side here. Aspirin is called acetyl salicylic acid. So if you compare the two molecules, you can see not much of a difference between salicylic acid and acetyl salicylic acid, except on the right-hand side of that molecule, there's a difference there. Now, what that is it's called an acetyl group. And what an acetyl group really is it's vinegar. So that smell you get from vinegar, that what you're smelling is the same thing as that acetyl group. And that's why if you leave old aspirin out, it starts, especially if the air has moisture in it, it starts to disintegrate a little bit. The aspirin will actually start to smell like vinegar because the acetyl group is actually getting dissociated from the salicylic acid. So you can see very similar molecules. However, the addition of the vinegar onto the salicylic acid does change the properties a little bit. And just stick with me because this is going to make sense in a moment. So the difference between salicylic acid, which comes from white willow bark, it's what gets converted in the colon, and aspirin, is that they both reduce inflammation, but aspirin also inhibits the COX enzymes. Now, the COX enzymes are the target for all of the standard anti-inflammatory over-the-counter drugs like ibuprofen, Advil, Motrin, and aspirin. They all work by inhibiting these COX enzymes. Now, what those COX enzymes do is they secrete or they produce pro-inflammatory and anti-inflammatory prostaglandins, primarily pro-inflammatory prostaglandins. So when you take these anti-inflammatory drugs and inhibits these COX enzymes, your body can no longer create these pro-inflammatory prostaglandins and inflammation goes down. That all sounds good. The problem is some of these prostaglandins are necessary and needed for repair and healing. We've talked about this with niacin before. It's not a good idea to just broad spectrum shut down all inflammation because some of these inflammatory mediators are actually needed to heal the tissue. A perfect example of this when it comes to aspirin is the ulcer risk from aspirin. So when you take aspirin, when it goes into your stomach, it inhibits the production of prostaglandins there. However, one of the prostaglandins that it inhibits is PGE2. And PGE2 is needed to repair the stomach lining. So when you take aspirin and it inhibits PGE2, you no longer can create the mucus that's necessary for the stomach, and the stomach lining has a harder time repairing itself. This is a big deal because the stomach is constantly repairing itself. We have a new outer stomach lining every 7 days or so. So when you block the repair process of the stomach, then these little micro ulcers that form all the time, but they heal perfectly, can no longer heal as quickly. And then they can build, and sometimes you can get a very symptomatic ulcer, which is what happens with aspirin. And so it's not because aspirin is acidic or things like that. It's because it inhibits these prostaglandins. And the same thing as the other anti-inflammatory drugs. So the benefit of salicylic acid is that it's also very anti-inflammatory, but it doesn't inhibit these pro-resolving prostaglandins. And so it doesn't directly inhibit the COX enzymes. So if it doesn't directly inhibit the COX enzymes, how does it actually work? Well, we know that some prostaglandins are pro-inflammatory, some are anti-inflammatory. So we don't want to inhibit both of them like aspirin does. So what does salicylic acid do? Salicylic acid will actually inhibit what's called nuclear factor kappa beta, NFKB for short, which is one of the master regulators of inflammation. This is a very important target to hit. And the benefit of reducing this inflammatory mediator is that in the face of chronic inflammation, lowering NFKB actually allows the tissues to heal better. Completely the opposite of inhibiting the COX enzymes. So this is a very beneficial target to hit for Crohn's and ulcerative colitis. Now, furthermore, NFKB has already been shown to be dysregulated in both Crohn's and ulcerative colitis. So we already know that it's dysregulated and it tends to be higher in those conditions. So inhibiting it allows the acute inflammation to go down so that the body and the colon can actually start to heal itself more effectively. Now, the cool thing or the interesting thing is that pharmaceutical companies already know this, and they've known this for a while. They know about NFKB. They know about the COX enzymes, and it's not good to inhibit them. And they came up with a solution. So drug companies saw the potential in aspirin and in salicylic acid to powerfully block inflammation in the colon from Crohn's and UC. But aspirin also had gastrointestinal and ulcer side effects. So they knew they couldn't use a drug that blocked all of the prostaglandins like aspirin does. Yet, salicylic acid doesn't have the same gastrointestinal side effects that aspirin has, or that the other anti-inflammatory drugs have. And so they saw that potential, and they saw that it could still block inflammation in a very beneficial way, but salicylic acid isn't patentable. It's actually found not just in white willow bark, but it's found throughout a bunch of different fruits and vegetables and spices. So we've evolved in hundreds of thousands of years. We've had salicylic acid coming in through our diet. So it's something our bodies have evolved with for a long time. And some researchers actually consider it almost like a semi-essential nutrient in a sense. It just happens to be found in very high amounts in white willow bark. So the companies came up with a solution. They created what's called the 5-amino salicylates. So let's take a look at that. On the left here, we can see salicylic acid again. And just to remind you, white willow bark, when you take it, it has salicin in it, and then it goes all the way to the colon, and in the colon, the bacteria converts salicin into salicylic acid. Now, on the right-hand side, we have the 5-amino salicylates, or the 5-amino salicylic acid. And you can see that the chemicals are very similar. The only difference is on the left lower hand side, they added that H2N, which is what's called an amino group. So that's why it says 5-amino salicylic acid. That's the only difference between the two. And there's a lot of brand names for this. And you might have, some of you have taken some of these, or you might be on them right now. And these include Pantasia, mesalamine, Lialda, Canasa, or Canasa, Desacoil, Acicol, Apresio, and SF Rawasa. Some of those I might have mispronounced. The important part is that they all have the exact same thing in common. They all are this molecule that you're seeing in front of you right here. They're exactly the same. Some of them are slow release. Some of them are, have a little bit different technology in order to get them to release in different places, things like that. But in general, they all are this exact same molecule. After companies realized this, prescribing 5-amino salicylates became one of the first line treatments, and for good reason, because they, like salicylic acid, also work by inhibiting NF-κB. So they work in the exact same way that salicylic acid works. And the cool thing is that they have a very high response rate. And what that means is when people take them, 40 to 70% of the patients get an improvement in their symptoms. And they also have a pretty high remission rate of around 15 to 20% of people that take them. So they really tend to get pretty good results. They can be taken long-term with minimal side effects. The only problem is really their cost. They tend to be quite expensive, but they are used as a first-line treatment. Now, one of the benefits of the 5-amino salicylates is that they're targeted usually to the colon. So they don't go really full body, they stay in the colon and they have their anti-inflammatory effect locally there. However, white willow bark sort of does too. You see, the salicin isn't active and it goes all the way to the colon before it converts to salicylic acid. So you get targeted conversion of salicylic acid in the colon as well with white willow bark. And unlike aspirin, the body, I already said all that. So just to reiterate, salicin converts to salicylic acid in the colon, giving you targeted delivery there too, just like the medications do, the 5-amino salicylates. Now, one thing to know is there is a difference between white willow bark and the 5-amino salicylates. And the difference is the other things that are in white willow bark. You see, white willow bark doesn't just contain salicin, it actually contains a bunch of different phytochemicals. It contains polyphenols, flavonoids and flavonols, proanthocyanidins, and tannins. It contains all of these molecules that synergize together to have a much more powerful anti-inflammatory effect than just salicylic acid on its own. Whenever they've done studies comparing salicin versus white willow bark versus aspirin, white willow bark gets the best results in terms of removing inflammation because salicin isn't the only active molecule. All of these components work together in order to have a synergy that lowers inflammation. And in fact, proanthocyanidins, which is also found in white willow bark, have been shown on their own in rodent studies to have powerful effects against ulcerative colitis. So there's not just one active molecule in white willow bark, and it's that synergy that's very important. So white willow bark really gives you the best of both worlds. It gives you salicylic acid delivered to the colon, and it also gives you a multitude of other beneficial phytonutrients. Now, a really cool side benefit to white willow is that it actually can help protect against certain types of cancers. Both isolated salicin and white willow bark have been shown to have broad spectrum anti-cancer properties and helped induce cell death in colon cancer cells. This is very important for those with Crohn's and ulcerative colitis because any long-standing colon inflammation will always put you at an increased risk of colon cancer, unfortunately. And that's just because The body's constantly repairing, it's constantly having to replicate new cells to patch up where the old cells were. And so you get a lot of DNA replication and repair, and sometimes the DNA can mutate and cancer can become more likely. Now, everything is a risk factor. So we can't say, you take white willow bark and you won't get colon cancer. That's not how things work. Everything's a risk factor. It's not just if you have colon inflammation, but what's your diet like? Do you eat McDonald's and fries every day? Or do you eat, a lot of good, healthy fruits and vegetables every day? Your overall diet is a separate risk factor that will influence your risk of colon cancer. And so there's these hosts of risk factors, and they all come together to determine anyone's risk for cancer. But it is a really cool side benefit that white willow bark can maybe help mitigate some of that risk. Now, how to take white willow. White willow bark is typically found standardized for 15% salicin. The brand now makes one at a very affordable price. Usually it's like $5 to $7, something like that. Usually the pills are 800 milligrams for 2 pills or 400 milligrams for 1 pill. And the standard dosage to start at is 3 to 4 pills a day. Although you can test with just 1 pill at first to make sure you don't have an allergy. And due to a good safety profile, you can discuss with your doctor about dosages of over 4 pills a day. Some patients do find better relief with 6 to 8 pills for a month or so before dropping back down. And similarly, some will increase their dose if they feel a flare-up coming. So unlike some of the other supplements we've already talked about, using white willow bark is a much more fluid approach, meaning you don't have to constantly stay on one dosage forever. You can adjust up and down depending on your needs at that moment. I've had patients that have had longstanding Crohn's that once they took higher dosages, like 6 to 8 pills a day of white willow bark, it really helped their inflammation go down and their colon to actually heal. And after a month or two, they were able to lower their dosage and still be in a very good place. So it's not something you become dependent on. So just keep that in mind. So when you feel like you might need it more, maybe you start to eat out at restaurants more often, maybe you're traveling, maybe you just feel a flare-up coming, you can increase your dose and help to mitigate or nip the inflammation in the bud in the beginning. But it's something you can kind of adjust up or down. The standard dosage is around 3 to 4 pills a day though. Now, white willow bark shares one side effect with aspirin, and that's ototoxicity, which can give you ringing in the ears or tinnitus. So this is usually very rare with white willow bark compared to aspirin, but technically any salicylate-based supplement has this side effect. Now, before continuing, I just want to tell you that I'm putting this in here for completion. It is a rare side effect. It's something that it's exact same side effect that aspirin has. So it's not something that pops up all the time. But I want to put it in here just so you know, in case you happen to be one of the people that do get the side effect, so you know what to do and how it works. But I don't want to scare you with this. So if you happen to notice any high-pitched ringing in the ears, discontinue the supplement and it should fade. After it fades, you can try a lower dose and see if maybe you won't get that ringing. If you already suffer from tinnitus, then any salicylate-based drug or supplement can make it worse. And thus, white willow bark is not going to be for you. So keep that in mind. Tinnitus is temporary if you stop the supplement after it begins. And it's rare, but I want to list all the possible cautions here. Now let's just put this into context with aspirin. So 4 pills of 15% salicin of white willow will contain 240 milligrams of salicin. Now, that has to go to the colon to convert to salicylic acid, and not 100% of it will convert. So the maximum dose of salicylic acid you can get is 240, and you'll probably get less than that. 1 tablet of aspirin contains 325 milligrams of acetylsalicylic acid. So you can see that 4 pills of white willow bark is less than 1 pill of aspirin. So just keep that in mind. So I'm not having you megadose this. This is not megadosing. This is very standard dosages. And many people have used much, much larger doses of aspirin and other salicylate medications for longer periods of times without any side effects. Again, just putting it in here for caution. Now, let's just say hypothetically, white willow bark is your supplement. It happens to be the one that works the best for you. When you take it, you're fantastic and you don't want to go without it. Unfortunately, it gives you tinnitus. It gives you ringing in the ears. What can you do? Well, again, you always want to discontinue the supplement if you do get the tinnitus. But when you reintroduce it back, you can try reintroducing it with other supplements that can help mitigate or get rid of the tinnitus. And those include glycine, magnesium, ginkgo biloba, and one that I forgot to add, which is taurine. In order of importance, I would put taurine first, then magnesium, then ginkgo biloba, and then glycine. Now, you don't have to try all four of those. Most of you will not need to take any of those. Again, this is just for those of you who happen to really want to take white willow bark, but it happens to give you tinnitus. Those are some options to try to help get rid of it. Now, if you're already taking a 5-amino salicylate based drug like Lialda or any of those other brand names we mentioned before, then white willow bark may or may not add more to that because it's just such a similar compound. However, the salicin that's in the white willow bark is not the only thing that's in there. We've already talked about the synergy, and that synergy will likely apply to the 5-amino salicylates as well. So adding white willow bark to a 5-amino salicylate drug might enhance the effect due to the synergy of the other components there. So it's still something. That doesn't mean you can't supplement or it's taken off the table. It may not work as well as someone who's not on one of those drugs already, but it also might. So that's just something to play around with and see how it works for you. And as always, make sure you discuss with your treating physician before making any changes to your diet, supplement, or drug regimen. This information, as always, is for informational purposes only. All right, we're almost done with the supplement part of the course. We do have a few more ancillary supplements to get to that can still make a difference in your condition. And I want to reiterate, not all of the supplements I'm going to be showing you have to take all at once. It's your body. You do what you want to do. You do what you and your doctor decide on doing. However, I want to give you all of the tools in the toolbox. Typically what happens is people will implement more upfront so that they can get their colon to a very good place, and then they'll start dialing back from there and see what they really need to take long term. We just finished the big 4 supplements. Again, that's niacin, vitamin D, melatonin, and white willow bark. And they're simple, but they can be powerful. So I hope you're thinking about this. I hope you possibly started to implement some of these suggestions by now. I would definitely implement these suggestions before getting into the diet part. Now, keep in mind, my goal is to make you as least dependent upon diet restrictions as possible. So make sure you are, utilizing these supplements, or you're doing what you can in order to make your life as free as possible. One thing I want to say is, I know taking time out of your day to watch these videos is something that we don't always have extra time. We don't always have, just time to sit around and learn information like this. So I really want to honor you, and I want to appreciate you because you're doing something that most people don't. Most people do not take control of their own health. They don't take control of their condition. They will either just let it go, or they'll do what their conventional medical doctor says. And even if it's not a great outcome, that's all they do. That's it. It just stops there. You're not doing that. You're looking for solutions. You're seeking, you're trying to find, you're going to experiment. You're going to figure out what works for your body. And that is such a great beneficial trait to have. And that's what's going to separate you from everyone else and actually allow you to experience eventual freedom from your condition. So I congratulate you and I honor you for doing that. So I'm looking forward to seeing you again in the next module where we're going to be going over a couple more supplements. All right. I hope you enjoyed this. I hope it serves you, and I'll see you next time.